Hi, it's Daniel from Supply PT, where we help people get back in motion. If this is your first time here, don't forget to hit the subscribe button and check out all the links mentioned in the video. They're conveniently listed in the description box below. Now, let's dive right into today's topic. Osteoarthritis is the leading cause of knee replacement surgery and affects millions globally. This condition arises from the gradual breakdown of cartilage within the knee joint. For those unfamiliar, cartilage is a smooth, rubbery tissue that acts as a cushion between bones, allowing joints to move without friction. It's what keeps your knee joints functioning smoothly during movement. However, as osteoarthritis progresses, this protective cartilage begins to degrade, and several problems arise. Breakdown of cartilage and its consequences. Bone-on-bone contact. As the cartilage deteriorates, it can wear away entirely in some areas, leaving bones to rub directly against one another. This bone-on-bone contact is extremely painful, as bones are not designed to touch. The friction causes sharp pain, inflammation, and swelling around the joint. Friction within the joint. As the cartilage becomes rough and uneven, the smooth gliding motion between bones is lost. Instead of moving freely, the bones grind against each other, which makes movement stiff, painful, and difficult. Over time, this constant friction can also damage the bone itself, leading to additional complications. 4 common causes of knee osteoarthritis, or OA, include 1. Age. OA is more prevalent in older adults due to the natural decline in cartilage's ability to repair itself. As people age, nearly everyone experiences some degree of osteoarthritis. 2. Obesity. Excess body weight increases stress on the knee joints, with every pound of additional weight placing 3 to 4 pounds of extra pressure on the knees. This added strain accelerates the wear and tear on joint cartilage, increasing the risk of OA3. Injuries. Previous knee injuries, such as fractures or ligament tears, can damage the cartilage and contribute to the development of OA over time. Even older injuries may predispose individuals to osteoarthritis later in life. 4. Repetitive stress. Jobs or activities that involve frequent kneeling, squatting, or lifting heavy objects, along with high-impact sports like soccer, tennis, or long-distance running, can increase the risk of OA by repeatedly stressing the knee joints. It's important to recognize that while these are common risk factors, osteoarthritis often arises from a combination of elements, including genetics, gender, and underlying medical conditions. Common symptoms of advanced osteoarthritis. As osteoarthritis advances, patients often experience a range of symptoms that can significantly impair their ability to move and perform everyday activities. Some of these symptoms include severe pain, often described as bone-on-bone pain. The discomfort can become unbearable, particularly during movement or weight-bearing activities like walking or climbing stairs. The pain can also persist when at rest, making it difficult to find relief. Difficulty with daily activities. Simple tasks such as walking, standing, or even sitting down and getting up can become increasingly challenging. Climbing stairs, once a routine task, may feel almost impossible due to the pain and stiffness in the knee. Joint instability and deformity. Over time, the structure of the knee joint may change, causing it to become unstable. This instability can lead to a feeling of the knee giving out when walking or standing. In severe cases, deformities in the joint, such as a bow-legged or knock-kneed appearance, can develop. Reduced range of motion. Flexibility in the knee diminishes as the condition progresses, making it difficult to fully bend or straighten the leg. This loss of motion can make routine movements, such as squatting, kneeling, or even sitting comfortably, incredibly difficult. A cracking or popping sound when moving the knee, swelling stiffness and warmth in the knee area. The impact on quality of life. Unfortunately, the effects of osteoarthritis extend far beyond physical pain. The limitations it imposes on movement and daily function can greatly reduce a person's quality of life. Here are some ways in which osteoarthritis affects patients. 1. Limitations in work, home, and leisure. The pain and stiffness associated with osteoarthritis often make it difficult to participate in work, recreational activities, and even routine household tasks. You may find it hard to stand for long periods, engage in hobbies you once loved, or keep up with the demands of your job. 2. Sleep disruptions. Chronic pain can interfere with your ability to get a good night's sleep. Persistent discomfort may make it hard to fall asleep or stay asleep, and the lack of rest can contribute to fatigue, irritability, and overall poor health. 3. Reduced independence. As mobility becomes increasingly limited, some individuals may need assistance with daily tasks like dressing, bathing, or cooking. This loss of independence can be difficult to cope with and may require the support of caregivers or assisted living facilities. Increased risk of other health issues. Living with chronic pain and limited mobility can lead to a cascade of other health problems, including higher rates of chronic diseases like heart disease, diabetes, and obesity due to a sedentary lifestyle. Mental health issues such as depression and anxiety often caused by feelings of isolation and frustration. Greater risk of social isolation as physical limitations prevent you from participating in social events or visiting loved ones. Increased likelihood of hospitalizations from falls or complications associated with immobility, such as blood clots or pressure ulcers. While osteoarthritis is a progressive and often painful condition, it's important to understand your options and work closely with healthcare providers to find the best treatment plan. Stay informed by clicking that subscribe button, stay proactive, and remember, here at Supply PT, we're always here to help you get back in motion.